Integrative Manual Physical Therapist, and I truly believe that we continue to mismanage the identification, assessment, diagnosis, and treatment of back pain. 16-year-old girl comes in. I had treated her in the past for a concussion. She is in track and she throws disc and shot. Back pain. It's worse when she's sitting. Her trainers told her to take a couple weeks off, which I appreciate that because clearly something is irritating it. But just resting it doesn't do anything to identify what's happening mechanically when this girl is participating in her sport. So she takes her 2 weeks off. She's doing what she's told. She goes right back to sport and her back starts to hurt again. Of course, because we've done nothing to address what's happening on a joint biomechanical, microbiomechanical level. So then trainer says, hey, you need to go see the doctor. Thank goodness, let's move this process forward. So she sees the doctor. The doctor prescribes her 2 rounds of steroids because I think we're just guessing at what it is. And then sends her to physical therapy, which I am classically trained as a physical therapist. A lot of physical therapists, they tend to do very general core strengthening, and the exercises that I see coming out of many clinics are the things that we did 20 years ago that didn't help my back, and they haven't helped a lot of my patients. For some patients, it is helpful, but for many, it is not, because it's still none of those things. Giving someone a steroid, sure, that's helping the body clear out inflammation, but it is still not addressing why she is having pain, what's going on mechanically. And pain is a message that we need to pay attention to. The body is trying to tell us, hey, there's something going on, or there's something that you're doing is really causing me some trouble. So it's not enough to just make the pain go away. And that's what most of our healthcare systems focus on. Let's just make the pain go away versus, hey, what's going on in the body? What does the body need? So that it's no longer sending out these signals of, hey, I need some help. So then, and so yeah, she went to PT and had some more exercises. Again, still those exercises, yes, that's nice to exercise, but if you've got inefficient mechanics that are driving your forces, you have to unpack those. And nobody has watched her walk. Nobody has asked her, hey, let's watch you throw. Let's look at your rotation. So as I unpack her, I watch her move. There is no movement through her upper back from T1 probably down to T12. And our kids and all of us, we sit all day long, so we get super tight through our upper bodies. We get super tight through our low pelvises. Our pelvis get stuck in this posterior position. So then after the end of our day of sitting all day long, then we get up and we go and do sport, or we work out, or we do our activities. And here this girl is trying to throw. She does not have segmental rotation throughout her spine, above and below. Most of hers actually is above. We had done some work a couple years before, down below. So I explained to her, and here's what's going on. When you are going to throw, if there's areas that cannot transfer the movement, the motion, the forces, the body's going to find a place for it to go, and so much of it really collects and amplifies exponentially at that lumbar spine. So every time she throws, the forces are going right down, and it's causing her to go into an anterior shear and a rotation. So then we start creating this hypermobility. Things get stuck. Then she goes to bend over. She goes to sit down, and here are these vertebrae that are kind of jammed and wedged in these positions that they weren't designed to do. And yeah, that hurts. That is not comfortable. And her body's going to tell her, hey, I need some help. But it's not enough just to make the pain go away. It's not enough to just exercise. We've got to understand what's going on mechanically and help restore the system so that she can do those specific rotatory motions that she needs for track, throwing disc and shot, without it all collecting in her low back. So her homework was getting back on that foam roll, rolling out the front of that pelvis so that we've got a clean leg swing. We're not sharing the lumbar spine. Absolutely foam rolling, especially with rotation, making sure she doesn't over-rotate her lumbar spine through the upper back. Then my work was to get in there mechanically and unburden, give her some ease inside out so that she